Obamacare, the taxes just keep coming. Our Lizzie McDonald just told us about the massive Obamacare tax increase on its way, but the Obamacare program, designed to help people with pre-existing medical conditions, is running out of money. The so-called Preexisting Condition Insurance Plan was supposed to help up to 400,000 folks, 400,000 people with pre-existing conditions until Obamacare fully kicked in next year. Now, the problem with that is that only 135,000 folks have signed up for it, and guess what they just did? They capped it. They said, we don't have the money. Their insurance is proving more costly than they had been, apparently they had believed. They'd been told that they didn't have enough money. They put $5 billion, appropriated $5 billion to back up the pre-existing condition program. Less than half of that remains available, and so they decided they better stop it now because they're spending money at an unbelievable rate. New applicants are being now turned away. On top of that, a majority of states are now rejecting what is, after all, the heart of Obamacare, the so-called insurance exchanges, health care marketplaces, where consumers can buy individual private policies beginning October 1st and then apply for, in some cases, government subsidies to help pay their premiums. 26 states have said to Obamacare, no deal. They're leaving it up to the federal government to set up those exchanges. 17 states and the District of Columbia are running their own exchanges. 17 states and the District of Columbia, and 7 states are partnering with the government. That's sort of a compromise. 17 states, 17 states, and D.C. Well, you know, they're doing it what they thought would do, leaving the federal government absolutely flabbergasted. They have no idea what to do right now. So why are 26 states opting out? Cost, pure and simple. Republican governors, 24 of whom have rejected those exchanges, say they simply can't trust the federal government to cover the full cost of operating an exchange. And guess what? They've got some pretty good evidence for that. Already, the pre-existing element of the program has been capped and shut down because they're out of money. Those governors look pretty smart right now. The taxes as a result of Obamacare, as you're noting, are showing up almost daily. So to keep up with what's happening to the tax burden on the American working man and woman, and particularly the middle-class working man and woman in this country, every night on this broadcast, we're going to be covering those taxes, the hidden costs, the public policy disasters that are mounting with each passing day, all of that which is Obamacare. Because Obamacare's sticker shock is worsening each and every day, and we're going to do our very best to put forward the truth about the cost, the taxes, and the functional result of these so-called public policies of Obamacare.